Good morning, everyone, and welcome to today's session. We're going to be looking at health at every size. My name is Stephen Pearson-Brown. I'm one of the health and wellness experts at ToHealth. And it's my pleasure to run through the session with you today. Now, it is a live event, so any questions that you have regarding the event, there's a message being put up there with my email address. So do feel free to drop me any emails. I'll answer them as soon as I can after the event, but we're not going to go through any during the actual session itself. It's half an hour, so it's a bit of a bite-sized session. There's an awful lot we could potentially cover in this session. So I am going to keep it quite short, sharp and snappy, just as it's a flavour session. What are we going to actually cover? I'm going to start off by looking at overweight and obesity, just to give us a bit of a grounding for what we're actually talking about. And then I'm going to move into this concept around the obesity epidemic before we go into the health at every size principles, which include weight inclusivity, health enhancement, respectful care, eating for well-being, and life-enhancing movements. And then I'm going to bring in the concept of epigenetics and epigenetics in weight management. And I think why I bring that in towards the end will come a little bit clearer as we get there. So you may be familiar with what you can see on the slide here. At the top, we have our body mass index categorizations. This is a calculation taking our height, our weight rather, in kilograms and dividing it by our height in meters squared. And it gives us a particular number which will fit into one of these categories. And you can see here that a BMI less than 18.5 is considered underweight, where the healthy range is considered between 18.5 and 24.9, before moving into overweight between 25 and 29.9, and then into the obese category above 30. And you can see how we have different categorizations once we get above 30, moving into obese 2 at 35, and this morbidly obese that we hear when we reach a BMI of 40 or greater. Now, body mass index is a useful tool, but it is or should be something that we use in conjunction with other tools when it comes to assessing the health of an individual, and particularly the health risks an individual may be at risk from. So we've already established, and there's some debate, but about the BMI categories that are used in different ethnic populations. And some populations, the marker of obesity is moved down to 27.5. So BMI is not a perfect guide. Another tool we can use is our waist circumference, which helps us to determine whether or not an individual may be carrying excess levels of what's known as visceral fat around those abdominal organs, which appear to have an increase in risk of cardiovascular disease and also type 2 diabetes. And you can see the ranges of the waist circumference in the pink box at the bottom of the slide, looking for men on the left, women in the middle, and the classification that they would be. I spent a lot of my career working in weight management with individuals. And the one thing that I think is very true is, whilst I left university thinking these are the benchmarks in which I need to go for, I understand that weight management is far more complex than just taking it purely on these numbers that we come up with. They're a guide to what an individual's risk may be. We know that as a nation, we are getting heavier. And what you can see on the slide essentially is data from England, this is NHS digital data, showing the increase in prevalence of individuals living with overweight and obesity from 1993 up to 2019. We can see that particularly individuals who are classified as being obese has increased almost double in that time period, with the sharpest increase occurring in the 90s and early noughties. On the right-hand side of the slide, you can see the prevalence of overweight and obesity in men and women. And we can see that women seem to have a greater or falling into the obese category slightly more than what we're seeing in men. So this is the situation that we're in, and we're finding this situation being pretty prevalent across all of the developing countries. And as a country becomes more sort of westernized or more developed, we find that the prevalence of obesity and individuals being overweight begins to increase as well. So that's to set the scene around individuals and the prevalence of overweight and obesity. But let's move on to health at every size. So it is a public health approach which aims to remove stigma associated with being overweight and obese and de-emphasizing weight loss. Interesting concept, because much of what we hear focuses primarily on weight loss being the tool to reducing our risk of health conditions. This is a new concept to me, but it's not a new concept in and of itself. In fact, the movement, if you want to call it that, actually began in the late 1960s. There was a major article published in the US called More People. There's a question regarding not being able to hear. I'm not sure if someone could check that for me. More people should be fat. Now, this was published in 1967. So it's an interesting thing that even back then, this article caused quite a lot of controversy around sort of what the actual situation or what individuals should be doing. And the movement started to build. And what we found was that in the year later, a first book was published called Fat Power. That was in conjunction with the author of the original article. And that led to the formation of the National Association to Aid Fat Americans in 1968, which changed its name to the National Association for Advanced Fat Acceptance in the mid-80s. And here we saw another movement start to build. And this is where we kind of developed into the health at every size concept. So beginning with books like Diets Don't Work, The Dieter's Dilemma, Breaking the Diet Habit, and eventually ending up with The Health at Every Size, and the book published by Linda Bacon, who did her PhD in and around this area. It's from Linda's book that we get a good understanding of where the health at every size approach does actually come from. There are some key principles that I want to spend some time going through. The first is around weight inclusivity. This they define as accept and respect the inherent diversities of body shapes and sizes and reject the idealization and patholizing of specific weights. Essentially, what they're trying to encourage is to absolutely patient or person center your approach around health and health risks, rather than using body weight as the primary focus. What they try to do is shift the blame that many people who attempt to lose weight feel when they don't succeed, shift the blame from them to the actual approach, saying essentially that it's not you that's failed, it's the dieting approach that was taken that has failed. And that brings into something I always remember thinking back to the very early days of helping people, is that there is no one size fits all. It should be a situation where you're able to adapt the approach to find the right one that works for that person. They ultimately aim to reduce weight stigma and body shaming, to minimize the negative self-image that may happen. Acknowledging the impact of involuntary and genetic environmental factors focuses on overall improvement of psychological well-being and aims to move away from the weight loss, weight gain, weight loss, weight gain cycle. The second principle is around health enhancement. Supporting health policies which improve and equalize access to information and services and personal practices that improve human well-being, including attention to individual physical, economic, social, spiritual, emotional, and their other needs. Talking about moving away from the concept of standardized policies that are designed to fit everybody rather than fit individuals. The aim is to remove fat phobia, weight bias, And there are strong evidence which shows that individuals living with overweight and obesity perceive weight-based disparities in employment. They experience a wage penalty, even when you control for socio-demographic factors. They face weight bias in job evaluations and hiring decisions. Stigmatized in TV and film, and have an increased risk of developing maladaptive eating behaviors. When we think about the bias that may be placed on individuals, we start to understand some of the complexities around it, because if an individual feels that they are biased against, they're less likely to engage in further support. Which links very nicely into respectful care, where we acknowledge our biases and we work to end weight discrimination, stigma, and bias, providing information and services from an understanding that socioeconomic status, race, gender, sexual orientation, age, and other identities impact weight stigma, and support environments that address these equalities. Around informed consent and body autonomy. As healthcare professionals, we have the potential to endorse stereotypes and negative attitudes regarding a person's weight. Individuals who are living with obesity perceive bias within their treatment and often delay going for support. Individuals may go for support about a completely different health issue. They delay it because they fear they're going to have the conversation around their weight. And unfortunately, many healthcare professionals receive very little training to support them to help individuals with weight management, and instead fall back on the old adage of just move more and eat less. In 2020, during the pandemic, we established that individuals who were having more severe effects from COVID infection had issues such as living with obesity or type 2 diabetes or cardiovascular disease. And the government launched a campaign to support individuals. They provided funding for local governments so that they were able to have tailored approaches to help people in those communities, reducing their weight being the primary goal. Unfortunately, it was rather poorly thought out in some respects. And actually, they've now recently announced that they are removing that funding. So where do individuals who maybe are looking at improving their health, where do they go? The only place that they can go really are where the focus is purely on reducing their body weight. What we kind of need to do is to make sure that we're looking at the individual as a whole, and we're not allowing these sweeping statements to become sort of the entire entity of the care and support that we provide. There was some immediate sort of questioning around the health at every size from a lot of the healthcare community. And the reply was that we're not talking about making everyone the same. What we're trying to do is to support individuals, to remove the stigma that individuals feel if they fall outside of a BMI category or a waist circumference. The part of the health at every size approach that from a nutritionist background I really connect with is the eating for well-being. The aim is around promoting a flexible, individual eating based on hunger, satiety, nutritional needs and pleasure, rather than externally regulating eating plans focused on weight control. Our body and how it regulates its weight and how it focuses on the food that we have is a very complex system. The health at every size kind of looks deeper into the regulation pathways that our body uses to ensure that we get enough nutrients to stay healthy. And the health at every size approach is trying to encourage us to go back to listening to what our body is telling us, rather than following set guidance that we're given. Providing someone with a diet plan is only going to be so successful to the point at which when the individual becomes bored with it. Telling someone this is the amount of calories that you can eat in a given day isn't getting them to connect with what their body is telling them. You're trying to override an instinctive function. This principle really is more of a tool, and there's key elements that it brings into it. Encouraging individuals to make peace with all types of food, removing this notion of good food and bad food. Often when people have a list of foods that they can't have, those foods become even more compelling and appealing. And actually, in some of the studies that were done, what they found was that many of the people who followed the health at every size approach actually did find that they lost weight, even though that was not their primary focus. But what they talked about was how much more they enjoyed their food, because it didn't come with a side ordering of shame or guilt. The eating for well-being ultimately completely rejects the dieting mentality. Let's look at the dieting mentality for a second. We've seen at the beginning the graph showing the prevalence of overweight and obesity. The dieting industry has been around for as long as I can remember. Doesn't seem to be having much of an impact. If the dieting industry had it right, then wouldn't we not see that increasing that way? It's again a fundamental flaw. We keep trying to do the same thing, but we're not getting any outcome. I believe it was Albert Einstein who said insanity is trying to do the same thing and expect different results. The eating for well-being is all about acknowledging hunger, allowing your body to tell you when it's time to eat and when it's time that it's full. And there are multiple hormonal changes, chemical messages that essentially tell us when we're hungry and when we're full. And many of us don't really acknowledge them very well. So the approach is all about trying to help people understand the cues around their satiety, this feeling of fullness. There's a big emphasis on satisfaction with food rather than calories or macros or whatever. There's a concept around, or there's an approach around supporting individuals to deal with emotions without the need for food. In fact, we've actually found that individuals who maybe are overweight or obese have a poorer relationship with food, and food comes more commonly as a way of dealing with emotions. The approach is about honoring an individual's health, and it incorporates exercise for movement, not just simply in the pursuit of burning calories. Irrespective of what you may ultimately believe around the health at every size approach, I think it's safe to say that the eating for well-being approach is something that we want to bring in to all areas of nutrition, not just in weight management. The final principle is around life-enhancing movement. Support physical activities that allow people of all sizes, abilities, and interests to engage in enjoyable movement to the degree that they choose. This is about autonomy. Not everyone feels comfortable in a gym. In fact, many people who had larger bodies actually said that they felt uncomfortable in many fitness settings. So how they feel in that particular setting becomes the barrier to them engaging in more movement. Movement's not just about a calorie balance. Physical activity is shown to be more useful in weight management than it is in weight loss. But even taking that out of the equation, physical activity makes us feel better. Whole host of chemical reactions occur that boost our mood. It can give us a sense of achievement. But many people perceive it as a chore because it's about calorie burning. So the life-enhancing movement tries to encourage people to choose movement rather than exercise, because they feel that way you open up more choice. I always used to use the term activity instead of exercise, because exercise kind of sounds a bit more formal. So activity can sound easier, but I think I'm going to change to using the term movement. How much do you move? We want people to feel that movement is a pleasure, because that way they'll keep doing it. Our lifestyles are becoming more sedentary because of technology advances. You know, even things like writing a letter to someone once upon a time involved quite a lot of movement. Finding a pen and paper, writing the letter, finding an envelope and a stamp, walking to the post office. Now you can do all of that from your phone lying in bed. You can even dictate it, so you haven't got to type it. Whenever we're looking at helping people to increase their physical activity, we always say to them, find things you enjoy and have a list of options, not just one or two. Consider the weather and the seasons. You might enjoy going for a walk when it's nice outside, but maybe if it's too hot or too cold, that will become your barrier. So find things that you enjoy. Movement can bring into things such as mindfulness, shown to reduce depression and anxiety, support our health and well-being, both physical and mental. So hopefully what I've kind of managed to get across is that the health at every size approach is about an individual rather than a set of rules. One thing is for sure is that weight management is far more complex than just eat less and move more. Which is the message we got from the politicians when they started the campaign. They said the simple approach, everyone just needs to eat less and move more. But it isn't that simple. I'm going to bring in the concept of epigenetics to illustrate how it's not that simple. So epigenetics, excuse me, is the study of changes in gene function that are mitotically or meiotically inheritable, and which do not entail a change in DNA sequencing. We all have a genetic makeup, set of genes that reside inside us. Epigenetics is looking at how those genes get turned on and off. We've seen how individuals who come from parents who maybe are living with obesity have a greater risk of becoming or living with obesity themselves in later life. We see that parents who are within the healthy weight bracket have children who also fit into that bracket in later life. But then we also have ones where that doesn't work. So it can't just be purely genetics. And this is where epigenetics comes in. Epigenetics looks at various modifications that occur through things like histone modifications, such as acetylation, methylation, phosphorylation, etc., and also non-coding RNA. The references at the bottom of the slide show information or research that came out, particularly Mahmood in 2022, looking at all of the different changes that are found. And the conclusion was that modification of histones are involved in epigenetic regulation of adipogenesis and may play a role in the development and progression of obesity. So it's not just about what you eat and what you do, it's about your genes and how those genes are expressed. In fact, research has also shown that even the exposure to nutrients in pregnancy before we're even born lead to epigenetic changes in specific genes, essentially turning them on or off, and altering obesity and diabetes prevalence in later life. So epigenetics is one part of this. Epigenetics doesn't come into any of the weight management philosophies because they all come into eat less and move more. Maybe there's more we need to be looking at. Look at the environmental factors that are potentially influencing the expression of our genes. Obesity is not simply the outcome of excessive food intake or energy imbalance. That is part of it, but it is not the whole picture. There are numerous epigenetic mechanisms that are implicated in diet-induced obesity. I'm going to show you some of them. We found that having a high-fat diet increases DNA methylation of a transcription factor called peroxisome proliferator activator receptor gamma. This influences mitochondrial activity and energy metabolism. Mitochondria is our energy power at the powerhouse of the cell. So anything that turns that up or down will influence our overall energy expenditure. Hypercaloric or high-calorie diets are found to modulate methylation of genes involved in metabolism and energy and appetite regulation, including leptin and adipose tissue. Changes to two enzymes known as histone methyltransferase and histone methylase have been identified in those living with obesity and are linked to several genes connected to the expression of genes involved in adiposity and metabolic function. Changes are occurring in the body which influence the regulation of weight going forward. And DNA methylation of leptin gene promoter has led to impaired glucose metabolism, decreased insulin sensitivity, and altered lipid profile, all things that we see in type 2 diabetes. And adiponectin, which aids energy balance and metabolic tissue, methylation of the gene has been positively correlated with BMI. So just moving more and eating less is not the full picture. The health at every size approach is one which focuses on reducing stigma and bias towards those living with obesity. Irrespective of each of the individual elements adapted in the approach, this is a key message we need to take away, because we've seen that through stigma and bias around body weight, shape, we make life harder for individuals. Individuals themselves don't come forward for support with any health condition because they fear that that will be the focus. It aims to provide a more holistic approach to understanding an individual's risk of certain health conditions, rather than simply lose weight. Many people who were followed in the studies around health at every size did change their body shape. Many of them did lose weight. But more importantly, their self-confidence, their belief in life increased. The approach does not say that it is not about reducing weight. It's just not the primary focus. It is far more complex than just eating less and moving more, as I've said all the way through. Strategies to support individuals to manage their health need to move away from purely focusing on body weight. It's only one part of it. When we look at helping people with hypertension, we found one of the most effective approaches we can take is to adapt the DASH diet, which isn't focused on weight, but has been found to significantly reduce an individual's blood pressure if they follow it correctly, but doesn't require weight loss. We know there are genetic factors that play a role in obesity. It's only part of the picture, and we're still in its infancy in understanding it. But when we think about weight regulation, weight management, and all the bits and pieces, what we need to remember is that it's far more complex. It's far more individualized than many times we get the message sent across to us. On the next slide here, you'll see there's a host of resources where all the information essentially has come from. I'm aware of time, so I'm going to say thank you all very much for joining us. I hope you found it useful. As I said at the beginning, that my email address is published, so please do feel free to send me any questions that you have. I'm more than happy to reply to any of them. But I really do appreciate your attention at 10 o'clock on a Friday morning. So I wish you a lovely day and have a lovely weekend when it gets here. And thank you very much.